Hi, I'm Amy Flory. I'm a physical therapist, and I'm going to take you through a series of core strengthening exercises designed for stabilization of your back during winter sports, snowboarding, downhill skiing, and cross-country skiing, although you don't have to participate in these sports to benefit from the exercises. Each segment is going to be progressively more difficult. You need to master the first one before you proceed to the second, and so on. We're going to start today with the most basic abdominal exercise. It will be the core, literally, of all of the exercises later on down the line. As with any health or fitness advice, there are some caveats and some rules. Caveat number one, you should not be doing any of these exercises if you have sharp low back pain or pain that is referring into the lower extremities or anywhere in your legs. If you have back pain, simply you may benefit from the first exercise today, but you really should consult with your physician or physical therapist before proceeding on to the subsequent exercises. Rule number one, form is king. If you can't do the exercise in proper form, then you won't be engaging the target muscles properly and efficiently. And what's the point of doing the exercise then? Number two, you should have no back pain or strain. If you should feel the muscles working, that's what they're for. But if you're having any pain or a sense of discomfort, then you need to stop the exercise. Make sure that you are, number one, using the proper form, and number two, that you're actually strong enough to do that exercise. Alright, our first exercise is called an abdominal brace, and it's simply a contraction of the deepest abdominal muscle, the transverse abdominis, that runs all the way around into the back below the belly button. And when it contracts, it cinches in the waist and it pulls in the belly button. So from the side, it's going to be simply a pulling in without flattening the back. So here I am relaxed, and here is a contraction of the transverse abdominis. I did not change the arch in my back. So you hold that for about 5 seconds and release, pull in again, and release. When you're comfortable with that, I want you to add some tilts at the pelvis, first from side to side. So again, I'm pulling in, and then I'm going to lift one hip, keeping this pulled in, and then to the other side. So this is something you can do kind of throughout the day. Just practice engaging those abdominal muscles. Then I want you to try forward and backward. So again, you're going to be pulling in. You're going to tuck the tail under just a little, and then backwards. All the time keeping your belly button pulled in. If I don't keep this tight, then my rib cage will collapse. So I'll give you an example here. Then I'm going to start collapsing down and slumping. So you've got to keep up tight right in here. Okay, do that a total of about 20 times a day. Make sure you're not having any pain and that you're totally comfortable with it, and then we'll move on to the next segment.